Welcome to This Explainer. Today, we're diving into a real-life medical detective story. And, it starts in the absolute most unassuming place, your family photo album. We're going to look at how a simple, everyday photograph could literally be the vital key to saving a child's life. It's a condition hiding in plain sight. Honestly, by the end of this explainer, you're going to look at the photos on your phone in a completely different way. So I want you to think about this. What does a white glow, or what docs call a cat's eye reflex, in a child's photograph actually mean? We all know that annoying red eye effect you get when a camera flash goes off, right? Well, sometimes, instead of red, a simple camera flash reveals this stark white reflection right in the pupil. And as we'll see today, this is definitely not just a quirky camera glitch. It can actually be the very first physical clue of a serious medical condition. Now, what's really fascinating here is the human element. The data shows us something truly awe-inspiring. In so many cases, parents are the ones noticing something unusual long before the doctors do. I mean, sure, a pediatrician might catch an abnormal light reflex at birth or during a routine checkup, but early on, these signs are incredibly subtle. Because parents are snapping those flash photos and, staring lovingly at their kids 24/7, they essentially become the absolute first line of defense. They're catching these clues before anyone else.
Okay, let's dive into this. Section 1, the culprit. What is retinoblastoma?
So, retinoblastoma is a rare, very fast-growing eye cancer. To really grasp the stakes here, we have to look at where it starts, the retina. Now, the retina is that absolutely crucial part of the eye that senses light and fires signals straight to the brain so we can see. It's like the sensor in your digital camera. Because this cancer kicks off right there in the eye's sensory command center, and because it grows so fast, any disruption is incredibly serious. It's literally targeting the foundation of a child's developing vision.
And speaking of developing vision, we really need to talk about who is most at risk here. This cancer primarily zeroes in on young kids, specifically targeting those who are under 2 years old. So we're talking about a disease of early childhood, striking right when these kids are hitting their very first major developmental milestones. To put things into perspective and ground us in just how rare this is, our sources show it affects roughly 1 in 15,000 births. So, yes, it's rare, which, hey, is a huge relief. But 1 in 15,000 still means a lot of families are suddenly facing this massive hurdle. And honestly, because it's so rare, it's almost never the first thing on a parent's radar. That makes knowing these early clues absolutely crucial. And this brilliantly illustrates that we aren't dealing with a one-size-fits-all situation. Retinoblastoma can pop up in just one eye, which doctors call unilateral, or it can happen in both eyes, which is bilateral. Whether it's unilateral or bilateral is a really big deal because it heavily dictates exactly how the medical team is going to tackle the treatment down the line.
Moving on to Section 2, the clues to look for.
Okay, here's your checklist. These are the specific signs to watch out for, ranging from super subtle to much more severe. First up, like we mentioned, that white glow or reflection in the pupil, especially in photos, or that cat's eye reflex. But it definitely goes beyond just a glow. You might notice crossed eyes, or maybe the eyes look slightly misaligned or deviated. A little one might be having trouble focusing both eyes on a single object. Now, as this fast-growing cancer progresses, the red flags get louder. We're talking a painful, red, inflamed, swollen, or even bulging eye. And tragically, if left unchecked, it can lead to decreased or totally lost vision. Spotting literally any of these is your cue to act right away.
All right, Section 3, the investigation and action plan. Let's move to and see how this builds the clinical journey step by step. First off, locking in a diagnosis means a highly detailed eye exam. Since we're dealing with babies and toddlers, this is done under anesthesia, so the doctors can fully and safely check out the retina without causing any stress. This is all handled by a pediatric ophthalmologist, a specialist who focuses 100% on kids' eyes. Second, the care team will likely run some extra tests. They've got to figure out, is the cancer contained or has it spread? And finally, step 3 is treatment. This totally depends on the tumor's size, where it is, and if it's in one eye or both. The go-to treatments? Usually surgery or chemotherapy. But the journey doesn't just stop after that initial treatment. Ongoing care is a huge piece of the puzzle here. Regular follow-ups are an absolute must. And yep, that means more exams under anesthesia to keep a really close eye on the child's progress. Now, in some cases, saving the child's life means the affected eye actually has to be removed. But the good news? There are some incredible practical solutions today. Kids can be fitted with a custom prosthetic eye, which helps them step forward with a real sense of normalcy after such a tough ordeal.
Which brings us to Section 4,
The verdict: hope and action. I know we've covered some pretty heavy, scary stuff today. Cancer, surgery, chemo for toddlers. But modern medicine offers some serious, undeniable hope. So the crucial point is this: greater than 95%. When this cancer is caught early, and when it's isolated to just the eye, over 95% of children survive. I just want to let that sink in for a second. That is a massive, incredibly successful survival rate. But, and this is a big but, it is entirely dependent on catching it early, before it has a chance to spread.
And saving a child's vision? That also depends entirely on exactly how early you catch it and where it's sitting in the eye. The biggest takeaway from everything we've looked at today is crystal clear. Early detection is absolutely everything. It can literally save a life. If you see that white pupil in a photo, if an eye looks deviated or swollen, do not wait. You've got to consult an eye doctor immediately. We can totally beat retinoblastoma, but it requires fast action. And that leaves us with one final, pretty vital question to ask ourselves. Are you paying close enough attention to the subtle clues in the photos you take of your loved ones? That quick, candid snap on your smartphone, it could actually be the very first warning sign. So stay vigilant. Always trust your gut as a parent or family member. And please, share this with the people in your life, because you really never know whose life a simple photograph might just save.